A 65-year-old patient had a history of open surgery for right renal stones few years back. She presented with right hydronephrosis and renal stones. Retrograde opacification found a complete obstruction of UPJ. A nephrostomy tube is inserted. Nephrostography established the complete obstruction of the UPJ. The ureter was not opacified. In the split-leg modified position, retrograde ureteral catheter insertion and opacification confirmed the complete UPJ obstruction. Simultaneous opacification through the nephrostomy tube showed a tiny gap between the ureteral catheter tip and the pelvis wall. Through an upper pole access, with a 24 French's Amplatz sheath, most of the stones are fragmented and extracted. Under fluoroscopy guidance, the nephroscope tip is placed in front the ureteral catheter tip. A suspicion of blue color is seen by transparence through the pelvic wall. Blunt dissection with the Alligator forceps finds the ureteral catheter tip and the UPJ is opened. Two double J stents are inserted.